Hey, Margie here. We all know that we can strengthen our bones, but did you know you could actually strengthen your teeth? Well, that's one of the topics we're going to talk about today with our very special guest, Dr. Sanda Moldovan. And Dr. Sanda is a double board certified periodontist and nutritionist. She's a biologic dentist and the owner of Beverly Hills Health and Dental Wellness. She is the founder of Orasana, a natural product line for oral health focus on nourishing the mouth and detoxification. And in today's episode, she explains why it's so important for our bones and overall health that we take care of our mouth and our oral microbiome. And she gives us some fabulous tools that we can put into our life that will really make a big difference. So, lots of great information. Stay tuned. Welcome, Dr. Sanda. I'm so happy to have you on the podcast. This is a topic that we really haven't talked about, but yet it's so important and something really everybody needs to know about, and especially everyone in this community. So welcome.
Thank you so much, Margie. I'm excited to share my knowledge.
So before we get started, before we even get started, why don't you just share how you got into that? I love the backstory on you're not just there's a difference in dentists. And a lot of people don't even understand that there's different types of dentists. But why don't you just share a little bit why you're so passionate about this and how you got into the specific type of dentistry that you do?
Well, I'm glad you asked, Margie, because, I really started as a traditional dentist. I went to dental school. After that, I went to traditional periodontal school. But, as I finished periodontal school, I did the same procedure on two different people. I didn't know why one healed well and one didn't at all. And I started looking into nutrition, was kind of my entryway into the holistic realm. And then from there, I started to look at myself and see, well, I have all these metals in my mouth. And, growing up in Romania, I had 16 large mercury fillings in my mouth. And I didn't know that it was making me not feel well. That was the cause of my problem. So as I started studying nutrition, I met the functional medicine doctors. Oh, you got to get your mercury out. So as I did that, I got healthier and healthier. So, but I went through the toxicity of mercury. I went through the, struggles of having a root canal in my mouth that affected my digestion. So I've experienced things that a lot of my patients coming in are experiencing. So I feel that challenge early on in my career helps me guide patients today into their treatment.
Oh, I love that. Well, since this is a community, a lot of the people listening to the podcast are really concerned about their bone health. Do you want to tell us why there's such a connection between our bones and our teeth?
Definitely. Well, teeth are bone. I know we don't think about it that way. Teeth are also organs, but the outer layer of a tooth is actually bone material. They're different density of bone. The top layer, let's say the enamel layer, or the one that we see, the one that everybody wants bright and white, that's a very, very mineralized layer of bone that basically forms the enamel. Underneath it, it's more of what we call dentin, is basically more resembles the bone. And if you look under the microscope, you have the same kind of porosities that bone has. So I always say that, the mouth is the gateway to your health. And if your bones become porous, we'll first see it on your teeth. So the teeth become porous as well.
That's so interesting because rarely do I hear about someone saying, oh, their dentist sent me to get more evaluation on my bones, but yet you'll see it in both places. So I think that,
Yes.
that's interesting. Do you do that a lot? Do you end up referring people because you notice something in their mouth, and then they also have issues in their bones?
Yes, definitely. As a periodontist, and as a biological dentist, we take cone beam CT scans, which are three-dimensional scans of the jawbone. And one of the features of the CT scan is to actually analyze the bone density of the jaw. And oftentimes, especially after menopause, we do see a more porosity of the bone in the jaw. Or it also depends, of course, on so many different factors. Let's say if somebody has more of an acidity overall in their body for years and years, we know that can cause more of a bone density issue. And if I do see that in the jaw, especially when we're trying to place dental implants and maybe replace some of the teeth, that's a problem. I also see sometimes I have some of my patients in their 70s and 80s, they're coming in and all their teeth are loose. And why is because the jawbone is becoming porous. So, it's something we need to address because as the teeth get looser, it's almost like a cascading effect. As it moves around, it causes more bone loss. And now we can end up with losing teeth early enough.
So that's so interesting because you're addressing the root causes, which we know are so important when it comes to osteoporosis. So it's going to affect both your teeth as well as your skeleton. So I think that's so important. A big thing we talk about when it comes to bone health is the microbiome. And we all know how important the gut is and that we need to deal with it. But there's also an oral microbiome that is so essential and truly often overlooked. So you want to just explain that to us and why it's so critical that we deal with this oral microbiome.
Yeah. We all have this, I call it the microbiome fingerprint in the mouth. And it's different from person to person. And over the last 10 plus years, I've actually been doing salivary testing for people suffering from, let's say, inflammation, gum disease, bone loss in the mouth, bad breath. We know that comes from the microbiome. So cavities, for example, that are attacking, the tooth. We know we test for that today because we want to know what kind of bacteria is that's causing cavities. Can we address it better? So in health, whether we're talking about gum inflammation or cavities, we want to keep the microbiome stable. We want to have that healthy layer of biofilm. So the biofilm or microbiome consists of the protein layer around the teeth, plus the different microbes that live in the mouth. And it's not just bacteria. It could be a little parasitic, fungal, but in the end, we want a layer that's anti-inflammatory and that's conducive to healing, to health. If the layer, let's say, based on our diet, we eat a lot of sugar, especially if it's the holiday season, that sugar intake goes up, you'll actually even feel that the teeth get fuzzy. So all of a sudden, you get these fuzziness on the teeth. That's actually the growth of bacteria. So the more sugar you feed it, the more it's going to grow. And unfortunately, it's not the good guys that are growing. It's usually most of the pathogenic bacteria.
That's so interesting because it was just Thanksgiving and I really don't eat any sugar, but I did have the organic, but they were some dessert. And it was so interesting how I felt it on my teeth. I'm like, this is really, I actually noticed a difference with my teeth. So it's funny that
Exactly.
that you're saying that.
Yeah, it loves it just as much as, people. They love sugar. And, the problem is with that acidity, when bacteria ingest sugar, they release an acid. And that acid can actually cause destruction of the teeth and an acidity in the mouth. That's definitely not beneficial for us.
Yeah, that's so interesting. So a biological dentist does something a little differently in terms of cavities. You have a little different approach for that. You want to just share how were saying you can actually do things, and when you reduce, improve the bacteria, it's going to reduce the cavities. So it's just a
Yeah.
little different way of looking at it.
Yeah. Well, we always want to start with the root cause. And I think that's one of the biggest differences of biological dentists compared to traditional dentistry. We don't have a drill and fill approach, which happens sometimes. In dental school, we go, so, oh, yeah, there's some holes in here. Let's start patching them up. Let's fill them to restore to health. But we really have to think back, why is that happening? Why do cavities happen? And it's not just bacteria, actually. It's also inability of the tooth to mineralize itself. So we're starting to understand now it's also an absorption problem. So a lot of people, especially kids that are suffering from leaky gut problems, they're not able to assimilate their minerals and thus putting it out in the saliva to help mineralize the teeth. So that's why we see still rampant cavities in kids that are young. Their moms say, I give them healthy food, everything's healthy. I don't understand why this is happening. But it's really that absorption issue as well as the microbiome problem. So in biological dentistry, what we try to do is identify, okay, do you have a leaky gut issue? Do you need to address that in order for your teeth to be healthy? And then secondly, what is the microbiome like? Let's work on the restoration of the microbiome first before we start drilling cavity. So what does that restoration of the microbiome look like? Is one, saliva test, and is like a home regimen. Okay, are we cleaning well enough? Are we using a toothpaste with calcium hydroxyapatite, where we're not fan of fluorides? Calcium hydroxyapatite works great as a mineral to mineralize teeth. And
wait, can you
then,
stop for a second?
yes,
Yeah,
yes.
that's one of the calciums that I think is so very effective. So you want to just explain that? So where is that in the toothpaste? How do you use that? Or is it a liquid? Just
Yes, absolutely.
that's so interesting.
Yeah, calcium hydroxyapatite is a basically a simulation of the crystal lattice of the tooth structure or the bone structure, which is calcium phosphate as a building block, and it leads to the calcium hydroxyapatite. It's like a lattice. So in nano format, what's interesting is that teeth that are alive, okay, I'm not talking about root canal treated teeth, teeth that are alive can absorb this mineral within their matrix and strengthen that matrix. If they're dead, unfortunately, that process just doesn't happen. How do you get calcium hydroxyapatite? Is via a tooth powder. And full disclosure, I have a natural supplement company called Orasana because this has been one of my passions, just natural oral health. So calcium hydroxyapatite powder is the best way, in my opinion, to really get that to absorbed in the teeth. There are also toothpaste with calcium hydroxyapatite that are basically meant to do the same thing to help to mineralize the teeth. And this is good not just for people with cavities, but also for people with dry mouth, people with sensitivity in their teeth, like to cold. You see thinning of that enamel. Or the edges of your teeth that are getting shorter and shorter. Calcium hydroxyapatite is a great prevention and a great way to maintain strong teeth.
Oh, I love this. So let's talk about how do you use the powder? What's the, do you?
Yes.
Yeah.
So I use the powder. Basically, I sprinkle a little in my hand. I dip my toothbrush in it, and I just use it with a manual brush, and I just make a rotation, round circles around the teeth. You want to focus out just round circles around the teeth, the back of the teeth, and kind of let it absorb. For patients that really have severe symptoms of sensitivity and cavities, I say leave it on your teeth. You don't need to spit it out.
Oh,
You can leave your cap.
so first do you brush your teeth and then you put the powder on? How does that work? Like, would you use your regular toothpaste?
Yes, you can brush your teeth first, or you can water floss first, and then you can use your brush. You could do 2 steps: brush first, and then put the powder on the second time, and leave it as a treatment on your teeth. So it can be used as a replacement for toothpaste, or as a treatment for the teeth, almost like a mask. The way we put masks on the face, I would say this would be like a mask for the teeth.
Oh, this sounds great. I know you're going to be sending me a bunch of the products because they sound so good. And this is, sometimes I've known the guest for a long time, but we met through a mutual friend who I've been looking for, like, who can be a dentist to come on and really in the same philosophy of that I believe in. And so I have not tried these yet, but I'm so excited because this is so up my alley and that sounds great. In terms of, is there a special toothpaste? I mean, not toothpaste. Is there a special type of brush? Like, is it okay to use the electric brushes, or do you have anything on that?
Yeah, it's okay to use the electric brushes, and especially people that have poor dexterity. If you have arthritis, your hands hurt, definitely use an electric brush. But for most people, I think using a manual brush, I'm particularly a fan of toothbrush bristles that are very, very thin, because those particular bristles can brush better underneath the gum and really keep the microbiome healthy right under the gum. If the toothbrush bristle is too thick, then we're having problems actually getting that sweep under the gum as we're doing the small circles
Oh,
around the
that
teeth.
that's great in terms of, I guess think
Yeah,
that
techniques.
yeah, such little things. Now you mentioned the water floss. Do you find that an effective strategy?
Yeah, and actually on my podcast, the Holistic Dentistry Show, I just did a whole show on flossing. I started, I being a periodontist, I like research. So I was looking to see what's going on. And I actually, there's more research showing that the water flosser and the in between little brushes, called like interdental brushes, clean better than string floss. They reduce inflammation within 2 weeks a lot more than string floss. As a matter of fact, Europeans don't recommend string floss at all because of the floss curts. So, United States sometimes is behind on certain recommendations, but all the data points to there's no reason to use string floss. The two best tools for in between cleaning are a water flosser and those little small brushes for in between.
Oh, what about the pick? I guess that's not the pick.
Um,
Not the pick. What is that called?
it's like the wooden pick,
The rubber tip.
like a rubber tip.
Yeah.
Okay, so rubber tips, you won't be able to go with a rubber tip all the way in between. And a rubber tip typically is designed for the gum line.
Yeah.
So if somebody has gum recessions or maybe they have a crown that, you're having a hard time, you can take a rubber pick and kind of test yourself. But you can easily replace that with a water flosser because the
Okay.
water flosser, you're also tracing the gum line, but it also shoots out water. So it rinses out as it traces. Whereas the, rubber tip kind of just traces. And you have
Mm,
to be good about it. Yeah.
that's so interesting. Back to osteoporosis and, toxins and heavy metals are a problem. And so, there are people like myself, I had an entire mouth of the amalgams in the fillings. And so, but there really is a difference. You just can't ask the regular dentist to remove them. You want to share why it's so important to do it in a special way?
Absolutely. And we're talking about amalgam filling. So when you look at, someone sees, we can actually see silver. Well, they're referred to as silver fillings. Unfortunately, they're not silver. They're 50% mercury. So we know that the moment we have the mercury fillings in a body, and actually the first studies were done on sheep, the moment they put amalgam or mercury fillings in the sheep, within a month, the sheep had mercury in the brain, and mercury in the lungs, had mercury in the kidneys. So it already spread everywhere. We know it spread. So we're all pretty much intoxicated with mercury at this point, including our planet. But it's important to, detoxify. Part of the detoxification process of mercury is removing the source of the problem. And mercury in itself leaches out slowly as we eat hot, as we brush the mercury filling. Particles just keep leaching out of the filling. So that's why we recommend removal. And why is it important to do it safely? Is because when we cut into a mercury filling, the level of the vapor of mercury in the air is very toxic. It's been measured and it's over 2,000 times more toxic than the EPA allows it in the atmosphere. And it's odorless, it's colorless. And if we inhale it, it goes straight into the fatty tissues. It's definitely important to do it safely. So in biological dentistry, our association came up with a certification for a mercury safe removal. It's called a SMART certification. You can find out a dentist in your area by going to IAOMT.org, somebody who's certified. And we take the precautions to basically isolate the toxic tooth, we like to call it, from the rest of the body before we start cutting into it. We have a huge suction that sits in front of the face to suck up all the vapor. So you, the patient, and also the assistant and the doctor doesn't get intoxicated.
Yeah, no, I had that done. And it was a whole procedure, what he was wearing, I mean, everything. But it really, it's interesting because I mean, there are regular dentists who will just take them out and not do any of these precautions, and I've heard stories of people actually getting sick because it was just too much mercury during the procedure, so I think that's so important. There's something else I know you're passionate about, and that's root canals, and there's a lot of people that get root canals. So you wanna just explain that to us, what the issues are and, what everybody should do if the dentist tells them you need a root canal? What would be what issues do they have to look at?
Well, let's start with that question. If the dentist tells you if you need a root canal, what do you do? I think number one you should ask is, well, is there an alternative? And really search for a integrative endodontist that can maybe offer you an alternative. Uh, Unfortunately, a lot of root canals are done preventatively to prevent pain, which I think it's a no-no. Which the tooth can heal itself when it's alive. So yes, I mean, I had a crown done where I had sensitivity in the tooth for 6 months, and this was, I want to say, 15 years ago. It's still fine. I did not want to go the root canal because I know the tooth heals itself from the inside. So the interesting thing, being an organ, it can deposit bone layers to separate itself from the cavity. So that's the amazing part about the tooth. But once you kill that tooth, now you're introducing a lot of bacteria inside the tooth. And even the endodontist community, they know, which are the root canal experts, they have studies to show that inside a root canal tooth, there's 50 times more bacteria than there is in a healthy tooth. And that's a lot. And, I take out a lot of infested, I like to call them, root canal teeth, because they're not necessarily infected. They're not full of pus and necessarily big like this, but when I take them out, they're black because of the mold. They also hold mold inside as well as bacteria and pathogen because, the mouth is a perfect environment for mold. So a lot of my patients, it's warm and moist. So that's perfect where, mold likes to grow. I recently had a patient just in the last week that, she came in very sick, anxiety, mold toxicity off the charts. And, 5 of her root canal teeth were moldy. And we ended up removing them. I mean, and unfortunately, we can't see these things only after removal, after we remove the teeth. But it's only after we remove this toxicity from the body that the body can heal. And I always say, the root canal teeth is, some people tolerate them, but we tolerate things up to a certain extent until our glass gets full of toxins. And the drop that spills the bucket, whatever that is, then all of a sudden everything becomes an issue. Something that we were able to tolerate 5 years ago, now we cannot.
That's so true what you're saying, because a lot of the body can handle some toxins. We're designed for that. But when it gets overfilled, all of a sudden everything falls apart. And
Yeah.
so if someone is told, if they see their dentist and they're told they need a root canal, what are the other options that are available?
The other options are, number one, like I did, it's like, let's support the tooth support regeneration through homeopathics. I'm big in homeopathics. Yes, it's going to be tender. The pain won't go away overnight, but are you committed to the process? And I've had patients that is, okay, I'll deal with the sensitivity. Obviously, if it's a tooth drops at night, it might be too late.
And what
The
about if it
nerve is
doesn't cause
dying.
any pain? What about if they just find it through an X-ray or without any pain?
So if that nerve is already dead, unfortunately, the tooth is dead. We cannot bring somebody back to life. So in that case, if the tooth is dead, root canals will buy you some time, but eventually bacteria will make its way inside of it because it's a dead bone. And unfortunately, the only part of the human body where we leave dead organs or dead bone is the mouth.
That's interesting though. But a person, I've heard people go to their dentist and they say you need a root canal because there's bacteria. Or I don't know how they determine that. They determine it on an X-ray or.
Yeah, so that's another problem. I don't think they're diagnosed necessarily properly. I think the
Mm.
only way to tell for sure is a cone beam CT scan. And maybe only 10% of dental offices today have cone beam technology in their office. Because
Wow.
we need to see things in 3 dimensions, not just on a regular x-ray. But, some dentists, they take off a crown. Oh, you have a huge cavity. Or sometimes there is a huge cavity and they say you need a root canal without even drilling, without even cleaning and giving it
Yeah.
a chance. It's like condemning the tooth. And the reason why they do that is because they want to save the patient from experiencing pain.
Wow.
But I think it's that conversation that we need to have. Okay, you will have sensitivity through the process of treating this tooth. Sometimes we never know which way a tooth goes when we start to clean out the cavity. But we've been surprised many times in our practice teeth that we thought this tooth is not going to make it. It does. So it's really, I think, giving the support from a whole, nutritional level, anti-inflammatories, ozone injections, homeopathics, antioxidants, really giving the support that the tooth needs to heal. Minerals, of course. Yeah, it's important.
How do you do the ozone? How does that work?
We're big ozone practices. All of our 3 locations use ozone because from the water to the gas. But ozone is O3, is 3 atoms of oxygen compared to O2, which is the oxygen we breathe. And ozone is a great detoxifier, sterilizer. And inside a tooth and inside the pores of the teeth, there is bacteria. And the only way to really clean it well is to ozonate it. We ozonate the tooth surface prior to a filling going back in. And I think that's one of the biggest difference with biological dentistry. Traditional, when I trained as a dental school student, take out the filling, you rinse it with the regular water, but there's still pores there, there's still bacteria, and then we put a filling on top. So we can't see bacteria with the naked eye. We're talking about microns here. So I think that the more we do in order to keep that underneath surface sterile, the better it is. The other thing is that I do for people that actually have a tooth, some sensitivity in their tooth, I inject ozone right on the outer part of the tooth. That ozone actually helps to oxygenate the tissue, brings oxygen to the area, and it really helps to heal.
Wow, that's so interesting. Yeah, it's you know,
Yeah.
like you don't know what you don't know. I mean, you go to the dentist and you're trusting, and not that there's a problem, but there's more that can be done that's not always that people just don't know about.
Exactly.
Do you
And I
find
think
that more people?
there's an assumption from the dentist, that people don't want to feel pain. And I think it's, for me, I'd rather take the pain for a couple of months, knowing that my tooth is not going to be dead than,
Yeah, and then
and I
once
think,
it's
yeah.
so when someone does have a root canal, or if there are people who have it, and it gets, would they know? How would they know from pain that it's infected or that there's more bacteria in it?
Unfortunately, because the tooth is dead, a lot of people don't have any symptoms about the root canals.
Mm.
The highly sensitive patients can feel it, can say, you know what, something's off. I can't put my finger on it. It feels tight. I don't know what it is. It's not pain, but I feel something's there. And usually there is. Yeah.
Mm. Interesting. And then do you have to remove the tooth?
Yes. When a tooth it turns dark and it starts to get moldy, we have to. The only option is to remove it, and the important thing is to remove it properly. And if we just remove it and we don't clean the surrounding bone, because this bacteria or mold that's inside the tooth has spilled now into the bone. And oftentimes after I remove a tooth, I look at the bone and the bone itself is black and it's now bleeding. So now I have to actually clean this. It's called a cavitation procedure, where we actually clean the microorganisms that are living in the bony area, because they don't need oxygen to survive. So they're living just fine in there. Again, I use ozone. I debride until we get nice fresh bone. And I never ever put a bone graft now into this site. I know some practitioners like to do that. If we look at the studies, the success rate of a grafted bone site is not as good as using just PRF. So I like to use the patient's own blood growth factors. We extract the growth factors, we put it back in the site, and we allow it to heal until we can, replace that area with an implant or a bridge or, another modality.
Wow, so interesting. So for everyone listening, what tips would you give everybody's listening. They want to take really good care of their oral microbiome. We already know about the, the calcium hydroxyapatite. I love that. I can't wait to try that myself. It makes so much sense from a bone perspective. Why not give the calcium to the teeth as well? So I love that. What other, we know about the water floss, and what other tips would you say are important things we can all do for our mouths?
Great question. So I think, especially since we're talking about bone health and gum health, especially anti-aging, um, number one is the three steps to optimum oral health. Brushing with calcium hydroxy, water flossing, and a chewable probiotic. But big fan of
Wait,
chewable
stop. A chewable. Oh, yeah. Okay. You're going to explain that. Chewable probiotic. Okay.
chewable probiotic. Exactly. It's basically a good way to replenish the oral bacteria. And the studies that have come out on chewable probiotics for the mouth have been really amazing in terms of decreasing inflammation. And how do probiotics do this is really at a genetic level. It really down regulates the inflammation and the cytokine level of the saliva. We do see that, especially for people that are experiencing maybe, burning mouth syndrome that comes with hormonal changes, or dry mouth. Having a chewable probiotic also stimulates the saliva. It lowers the level of plaque on the teeth, especially as the mouth gets drier. People feel that fuzziness on the teeth. So I always say, take a chewable probiotic, especially at night. It's the last thing before you go to bed. Also,
Oh, so what you
yeah,
would do is just once a day, right before you go to sleep. Isn't that interesting?
yeah,
And then you can do that in conjunction with your regular probiotic that you take. This is not in lieu of, this is in addition to.
exactly. Because the oral microbiome is a little bit different than the gut microbiome. We're looking for different species of bacteria.
And is that part of your program? Or you do, right? You have an oral
It
as
is.
well? Yeah. Well,
Yeah,
that's
it's our you want to restore oral care system, because we want to restore and renew the teeth and restore the microbiome. That's really the whole idea, and that's a great way to prevent things from happening. And what we're noticing also with the chewable probiotic is great also for like throat health, for actually sinus health. So because the microbiome doesn't just stay in the mouth, so it kind of trickles to different areas in the surrounding neighborhoods.
Oh, I love that. Okay, continue. Okay, so
Yeah.
we have
Okay.
you
And other tips that I have, I think taking collagen peptides. Great, of course, for bone, for joints like the TM joint, but also for gums. Keeping the gums resilient as we get older, the gums get thinner. I'm starting to notice even myself, I'm being extra careful. Don't overbrush the gums, especially if you have thin gums. Um, and really giving it the building blocks to help with the long-term stability. That's
so the
important.
collagen peptides is just the oral collagen peptides that we would take for it's the same
Yeah.
collagen. That's not a special oral one we need to take.
No, no,
Okay.
that's just your regular collagen peptides.
Okay.
Yeah, that are great for our health. And we know that collagen fiber itself actually decreases, it does become thinner, and it applies to the guts as well.
Oh, okay, great. Any other ones? Okay, so far I'm loving all these.
One of my favorite supplements to take, and I think it plays a huge role for oral health, is vitamin D3. Vitamin D3, K1, K2. We know that people with higher vitamin D3 levels, they have less incidence of cavities, gum disease, and tooth loss. So very, very important to keep up with vitamin D3. Vitamin C is a very important one. I like to get that usually from fresh fruits and vegetables. Vitamin C is great for collagen support and gum health.
Yeah, so important also for the collagen matrix for our bones. So it's this all goes
Exactly.
together. Everything you're talking about is also so
Yeah,
important for bones. So it's
yeah,
yeah.
absolutely.
Okay, well those are great. I just love those tips. And yeah, is there
What
anything and you also talk about just detoxifying in terms of the mercury. Are there any other things we need to do to detoxify?
I think those are the main things. Staying nutritionally fit is important, but really checking into the mouth, because I speak with a lot of, healthcare fanatics, and, holistic, and the mouth is the last thing they think about oftentimes. And it's it's part of your body. It's not separated. And I think really starting to do a self exam. Yeah, I know a lot of people, there's a fear surrounding going to the dentist, but I think really finding the right practitioner, that you can, trust and rely on, and really somebody that you can feel comfortable discussing options. Because, doing active dental treatment is not an option for everyone. But there are certain things that you can do at home, especially if problems are recognized early enough, that we can reverse. We can reverse cavities, we can reverse gum disease, inflammation, bad breath. There's so many things we can help with if we detect them early.
Yeah, no, and it's exciting because so much. I know I'm a big believer in that there's so much that can be done. We just need to know about it so that we can take the right action. And will people, how soon, once they start really doing these things, how soon do they notice a difference? Like, for example, loose teeth. Can that actually, have you really seen the gums improve in terms of that?
Yeah, well, for loose teeth, it takes months because it took months to get. It took
Yeah.
years to get there. Osteoporosis takes years to develop
Yes.
and go silently. So we actually do need to splint the teeth. When teeth get loose like that, we actually split the backside to give them stability, so that the bone can strengthen. But yes, it can happen. We can actually help with that bone density.
Ah, this is so great. Well, tell us, you're being very kind and you're giving our community a little discounts. You want to just share about that, about what's in, what are options with some of the products that you talked about?
So I think a good place to start on orasana.com is, with our basic 3 steps to renew and restore your mouth and your microbiome. Um, and that's where the calcium hydroxyapatite will help, to balance. And, I always try to make products that are good tasting and that actually have an effect on teeth. So none of our products have harsh chemicals. They're good enough to eat, so to speak, but really, like, we wanted to make them tasty enough for kids. We have, collagen peptides on our website as well. So just a variety of different things that help to strengthen the teeth, even from within, such as, phosphate, calcium, magnesium, things that work together, because it's never just topical application.
Yeah, that's just wonderful. And you're giving, people should just use the coupon code Happy Bones.
Yeah, that's correct. You get 50% off using Happy Bones coupon on orasana.com.
Okay, fantastic. Now, I have one other question. You mentioned that there was that certification for people who are trained to take out the mercury fillings. Is there, if people are looking for a holistic dentist, similar to you, where they live, is there any other organizations they should look for, or that's the best one?
So IOMT, because I belong to it, I know it well. So I know they are particular about what they list there. There's also IABDM, National Association of Biological Dentistry and Medicine. Those are, I think, the two main ones if you're looking for a biological dentist. We're trying to, and the whole reason for the certification is to use something that's scientifically proven to protect you from mercury.
Yeah, no, so very important. Now, I know we have a mutual friend who's flying out. So if someone wants to actually see you, people have been flying out to see you. Is that correct?
Yes, that is correct. I've helped a lot of healthcare practitioners, and people that have been suffering, just like me, actually. Um, they come to us and we're able to take care of things. We have a lot of high tech in our office, laser procedures that we do to help ceramic dental implants, for example, to replace root canal treated teeth. And we're able to do things faster. I have a great team of 4 doctors, and we work together, to be able to give you the smile that you want and feel comfortable.
Oh, that's great. And so what is the website then people would go to for that?
The website of our practice is beverlyhillsdentalhealth.com. We have locations in Beverly Hills, Newport Beach, and Encino.
Okay. Yeah, because dentistry isn't something we can do virtually. We can counsel people, but you really can't do dentistry virtually.
So true.
I'm a physical therapist and I still believe in hands-on, but you can help people with their exercise. You can help people with certain things, but dentistry, when you really have to work on someone,
It's
you
so true. And
really do need
sometimes
to
what I
see.
do, the only thing that I can't do virtually is a consultation.
Oh,
People
you
will actually
do?
send me, yeah, so people will send me their CT scan in the mail.
Oh,
And I have them send me some selfies, of their teeth and their smile. And then if I have a CT scan, then I'm able to do a phone consultation.
oh, that's wonderful because I would hate for people to have procedures unnecessarily. That And I have found my whole life, actually, I have all sorts of issues with my mouth that started from people filing because my mouth wasn't great and different things. And I worked in TMJ for many, many years. So I worked with so many people. And unfortunately, they should have gone to physical therapy first and loosened their muscles. But regardless, um, but anyway, the point is that, be having the right treatment plan is so important. And just, unfortunately, I just saw, I don't think anyone meant any harm, but people really rushing. You need a root canal. You need these crowns. You need, they're rushing into major, major treatments quickly. That's what I saw. That's what I've seen in my life that, I had to second guess a lot of things. It's really quite unbelievable. And, but that's my feeling on life too. You have to know, you have to understand, be knowledgeable and dig deep so that you really figure out, what's going on.
Yeah, I agree with you. Always take a step back and say, what's the alternative? The more we drill on teeth, the more of a likelihood is that they become sensitive and die.
Yeah. Yeah. So interesting. Well, this has been just fascinating. I just love, I can't wait to try the, the powder.
Yes.
And, yeah, I don't water floss, but now you've motivated me to add that to my regiment. And,
Yeah, we'll send you one, definitely. Definitely. And the other thing that a water flosser does is the pulsation stimulate collagen.
really? Oh, how
Yeah,
interesting.
they actually have a hydrofacial. Basically, it's like water used for the face to stimulate collagen. Well, the water flosser, by basically pulsating on the collagen fibers, it actually tightens the collagen. So,
Oh, I love that. Well, is there any
yeah,
last minute thing? This has been so helpful and so insightful. Is there any last minute thing you want to share with the community?
it was a pleasure. Thank you very much, Margie, for letting me share my thoughts. And just remember, the mouth is the gateway to your health. So take care of it in the best possible way.
Oh, well, thank you so much. It's just been a pleasure.
Thank you.
Wow, I learned so much from Dr. Sanda, and I hope you did as well. She gave us some great actionable steps that we can all put into our life to improve the health of our teeth, gums, oral microbiome, and that in turn will improve our overall health and our bones. So lots of great information. All the links will be in the show notes. And she forgot to mention that on her website, she has a free ebook called Detoxify Your Mouth that everybody can check out. So thank you so much for tuning in, and I look forward to seeing you on the next episode.